News Talk 760 WJR presents Living Pain Free with host Warren Pierce and special guest Jeff Morton. For WJR, here's Warren.
All right, Mark, thanks a lot. Welcome in. For the next hour, we're going to do our best to make sure that if you or a loved one suffering from chronic pain, it's time to experience a proven revolutionary treatment option. Pain Free Life Centers, the exclusive practitioner of this high-dose laser therapy for pain management in the state of Michigan. As we say hello to the director, Jeff Morton. Nice to have you back with us. As usual, there are some listeners who have heard us talking about how laser goes about reducing or eliminating pain. In fact, the last time we were together, I brought up, and you knew this, when it comes to how laser therapy works. The laser invented in 1916 by Albert Einstein.
Yes.
So obviously you've done a lot of research. You've been doing this for years now, not only successfully in Troy, but opening a new location in Shelby Township. But he conceived the theory of light amplification through stimulated emission of radiation, or LASER, laser. And then there was this other fellow I read about too, this Professor Andre Meister, who began using low-power lasers in medicine. And he's recognized by many as the grandfather of laser therapy. But getting back to what you all do there in Shelby Township and Troy, how does a laser work? Obviously, it's not invasive, doesn't even touch the skin.
Right, Warren. Well, as you know, you've had the treatments.
Yep.
But so science has proven that human cells respond to light. And there are many different frequencies of light that can be used. But the frequency and wattage of light that we use at Pain Free Life Centers is specifically developed to penetrate below the skin to the damaged cell. It gives that cell the ability to produce energy known as adenosine triphosphate, or ATP, which is the body's natural energy source. When that happens, it takes an unhealthy cell and gives it the energy that it needs to become healthy. Healthy cells create healthy tissue. Healthy tissue increases blood flow. When you increase the blood flow, that carries oxygen, enzymes, and nutrients to the tissue that's damaged so it can get healthier. And it stimulates the protocol of what's called photobiomodulation. And that is a cascade of physiological events that happens in the body. And that's science's word, photobiomodulation. It's complicated, and I know you love that word.
Right.
But photo is light, bio is life, and modulation is change. So really what science has named it properly, because the light from the laser penetrates to the cell, your body, and changes the molecular structure of the cell to make it healthy. This stimulates the release of nitric oxide, which is the body's natural anti-inflammatory. So how does the body heal with an injury? It needs more blood flow and less inflammation, and then the body's able to heal.
Well, and over the past, I want to say 25 years, you and I have talked about the number of years since laser has been used to eliminate and reduce pain. Since, I think, this laser treatment, this laser therapy got its first FDA clearance. That was back 25 years ago. We should point out that this cold laser therapy, and we can talk a bit about what that is too, has exploded. Where you've got chiropractors and acupuncturists and physical therapists. They're all getting in because they know the success it's had, beginning with animals and dogs and being used on horses. The Preakness coming up. These Preakness horses running in the second leg of the Triple Crown will be getting laser treatment. And then the therapists, the professionals who are working with athletes started using it. And now, obviously, it's gotten to the average person to help them deal with the pain they're experiencing.
Right. Pain Free Life Centers, we're the pioneers for laser therapy. We're the #1 laser pain clinic in Michigan. We're the only standalone laser pain center.
I mean, that's all you do. These other medical people that I just mentioned, all right, let's try that.
They use it as an add-on modality to help their patients when they don't know what else to do. And we are the experts in the field. Nobody in Michigan has more experience or a better trained staff than we do at Pain Free Life Centers. And we really, we live it and we eat it and we breathe it 24 hours a day. I barely sleep. I'm always thinking about my patients. I'm up early in the morning talking to you on the radio. And I mean, we're totally booked tomorrow in Troy. We have 8 new patients to see. Just in Troy alone, we see 75 to 80 patients a day. And all we do is laser therapy. So when you hear about lasers with the chiropractors and the podiatrists and the DOs and orthopedic surgeons, they're using a low-level laser, and they're using it in a, I wouldn't say in a non-expert way, because they really don't know the protocols. The protocols really have been developed by Pain Free Life Centers, and it's been an 8-year journey for us, and we've been open. We're in our 6th year at Troy, and we're doing really well there, and Shelby's doing really great, and the people from Macomb Township and Shelby Township have really welcomed us into their area, and we're just passionate about what we do. We change lives. It's today I have to say, I promised my newest patient, Molly, and her friends are listening.
Right.
And, she came in this morning for a treatment, and she's our newest patient, and she's tried everything. People try everything. And
what was her problem?
She had a sciatic nerve pinch that was creating just a pain in her foot. And it starts in the lower lumbar region, and she brought her MRI in. And
then it goes around to the front, down the thigh.
Right.
Yeah.
It controls all the nerves all the way down the leg. But she just had a pinpoint pain in her foot. And a remarkable woman. You never know how old she was. She's in great shape, very active, runs a family business. But she had this nagging pain. And the doctors didn't know what to do. They wanted her to try physical therapy. Well, that's not going to unpinch a nerve. And so we use the laser and pinpoint directly to the source of the pain. And because she brought the MRI in and the report, we were able to know exactly where to treat her, and we'll take care of her problem. It's just...
But you don't necessarily need an MRI. You don't necessarily need an X-ray. Your patients pretty much come in and say, okay, here's the pain. And most of the folks that you serve, lower back. But it could be in the foot. Maybe it's plantar fasciitis. Here, it's my arm. It could be carpal tunnel syndrome. So you don't need necessarily that. Just show you where the pain is, and then you go to work.
Well, the issue is, Warren, and you're correct, we don't need that. But most of the patients we see have seen specialists, multiple specialists. They're doctors. They've done physical therapy. They've been on the pain meds. They've had cortisone injections. They've had epidurals, maybe one or multiple surgeries, or they're contemplating surgery, and they're still in pain. So they come to see us not knowing what else to do. And, we have patients come as far south as Cleveland, Bowling Green, Ohio, from Grand Rapids, Holt, Michigan, Belleville, Michigan. I have someone that comes from West Branch, Michigan.
You say I have somebody who used to come from Florida, right?
We had two people fly their parents up from Florida and stayed with them for 8 weeks to get their treatments with us at Pain Free Life Centers. That's how far the word travels.
And you talk about the increasing number of patients you have coming in to get your advice, get your treatment. And we should quickly mention that as we speak, and we'll be around till 8, and we'll invite your questions. You have a specific pain, a problem, someone in your family, someone who you work with, we'll encourage you to call, talk to Jeff. But you've got the wellness coordinator standing by, because it really fills up. And your first consultation, your first treatment, you're going to give for free. So you want them to call those folks who are standing by. Where are they, in Troy tonight?
Yeah, they're in Troy. They're booking for Troy and Shelby. So there's Tammy, Karen, and Michaela standing by at 248-879-1100. Call and make an appointment. We're already totally booked for tomorrow, Wednesday, in Troy, so we can see you in Shelby, or we'll double book for Troy. But, this week is just crazy busy, because here's what's happening. The weather's getting nice.
Yep.
People want to get outside. And they've been sitting around all winter, and the pain is just taking their life away from them. And remember, pain just doesn't affect the person in pain.
Right.
It affects their loved ones, their spouses, significant others, their children, their co-workers, and your own personality. And, when you take the opiate drugs, it creates constipation, it makes you lethargic, it gives you hopelessness.
How about getting hooked?
Oh, well, yeah, the addiction problem is huge. And I got to tell you, Warren, I was at the VA hospital last week because, we're doing this VA program for the veterans. And talking to the director of the pain department there and seeing all the veterans in pain, it's really sad. And they want to get the veterans off the pain medications. And I got a call from another gentleman right after, who's one of the directors down there. And the new soldiers that are coming home from Afghanistan and Iran and Iraq and all the Middle East, they don't want the drugs. And so the Veterans Administration is looking for an alternative, and we're going to be able to service the veterans and get them taken care of without any out-of-pocket money. It's going to be a great program that we're going to do.
Yeah, so keep it in mind. Call the number and make an appointment right now, 248-879-1100. You also bring a guest with you, a patient that has come to the Pain Free Life Centers to deal with, in this case, every guest that you've brought in the past, it's revolved around pain. But this issue that she has been experiencing and finally resorted to going to the Pain Free Life Centers has, I want to say, nothing to do with pain. It's something I've never heard you talk about before, right. And we'll get to that in just a jiffy here on News Talk 760 WJR as we continue here on this radio station after a word or two from our sponsors.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And as we have been talking, this pain that you're experiencing, someone in your family is experiencing, someone you know, and by the way, here's the phone number to call. If you have that pain or you know who's someone who does, call us up directly and we'll put you on the line with Jeff at 1-800-859-0957. But, and you were alluding to this a little while ago, Jeff, limits not only mobility, but also the quality of life. People who are looking to relieve pain try all sorts of procedures, injections and surgery and drugs. But we're talking about the ability for the laser to take migraines, for example, reduce and eliminate those rotator cuff injuries, knee tendon ruptures, plantar fasciitis, only a few of the pains that can be really present in our head, our body, our feet, you name it. And you bring in with you this evening a woman who, Michelle Ferris, who is experiencing what? Not pain, Michelle, but nausea. And how did that begin to impact your life?
Well, I had surgery for a hiatal hernia back in January, and it was the second surgery.
All right.
The second time I'd had that surgery. I had one 3 years prior to, and that failed. And so now with the second surgery, when they redid the hiatal hernia, they must have, after doing my research, they must have hurt or irritated a nerve plexus to hold my stomach down, to anchor it down so it wouldn't keep coming back. And what I was getting was nausea. And I at first didn't realize how nauseated I was.
You were sick to your stomach.
Sick to my stomach. But in the beginning, it wasn't there because I was still taking all of the medication. It was when I started...
Why were you taking medication? For this symptom or something else?
Well, obviously it was for the nausea that I didn't realize that I was having until I stopped taking it. And then this nausea came.
No one told you, here, just take this prescription or take this drug,
no, I
but
couldn't
didn't tell you why they were prescribing it.
I had no idea because I had this surgery before and I wasn't on any of these medicines.
Right.
So I just didn't understand what was going on. Why did I need it this time? So I did like I was supposed to. I put the patch on, took it off every 3 days. And then when I got down to the end, and the prescription was very expensive, I thought, well, I don't need this anymore. I'm I'm almost 3 months out and, I'll be fine. Oh, no, that to say the least. And I would have these episodes where I would eat and then all of a sudden it was a nausea that I cannot explain. I don't ever want to experience it again as long as I live.
Well, but wait, you've got decades, Michelle, worth of experience as a licensed practical nurse. So you know what you're talking about. Mm-hmm. You're aware of symptoms. You're aware of suggestions as to what to do. Had you ever heard of anything like this in your career?
No, I had heard about the Pain Free Life Center because I'd heard it on
But
your
babe,
radio.
even before the Pain Free Life Centers,
Oh, no.
had you ever heard that an operation like this could cause what you were experiencing?
No,
And,
I did not
and the
think
result,
so.
what were you going through on a day-to-day basis with that?
With the surgery, prior to the surgery?
No, after the surgery,
Oh,
after you had this
constant
nausea?
Nausea. Nauseated constantly.
What kind of life were you living then?
I wasn't. I was living on the couch. I was just on the couch. I couldn't get up. If I got up, I was so dizzy from being. It's like it's nausea that you're circling the drain. It just doesn't go away. It just stays.
What were the doctors suggesting, or medical professionals, as a result when you told them, look, I've got this nausea, I can't even get off the couch?
I went to my primary physician, and he put me on a medication for to try to settle that nerve down in my stomach, and I just did not react well to that. I just felt like I was, constantly drunk the whole time. It just like you're out of sorts. So I refused to take that medicine. And then I thought, well, I had heard about the Pain Free Clinic, and I'm thinking, well, they work with pain, but
Right.
it's also nerves. Why couldn't they do this? So, so I made my appointment, and I went in, and at first they didn't think they could help me. And that was not what I wanted to hear.
No.
I really did not want to hear that
Jeff
at
Morton,
all.
and you obviously,
No.
we talk about, you've been doing this for years at the Pain Free Life Centers, dealing with people's pain. And I don't know what I have, what do I have in the lower back there?
Stenosis?
Yeah, spinal stenosis.
Right.
And other pain as a result of a pinched nerve in my neck. A pinched nerve, and Michelle's kind of alluding or suggesting that maybe the pinched nerve was causing her nausea. And I don't know, did you think pinched nerve, maybe we can, because I don't think you ever handled a case like this, have you?
Well, I never handled a nausea case, so that's one thing. But the fact that she had 2 surgeries, I just kind of thought that there was a chance of some scar tissue buildup and some scar tissue creating maybe an impingement on the on her nerve plexus, which
Right.
is a bundle of nerves that run. There's 4. They run the stomach. They're intertwined with They're intertwined with veins. And so I thought, and when Michelle first came in, actually, we weren't going to treat her. And I had my wellness coordinator and one of my naturopath doctors going to talk to her. And after dealing with her and talking with her, we decided that we were going to give it a try. And thank goodness it worked, because we were actually able to change Michelle's life, I think.
Right.
Yes.
And this was your last resort. And you know what you say, Jeff.
Make Pain Free Life Centers your first choice, not your last resort.
But you were concerned that Jeff was, he had never really dealt with anything like this. Maybe not. So how did you respond?
Well, I responded. It took 6 treatments before I started to really see any improvement, because they said it was accumulative. So
Sure.
I'm gonna, I'm gonna do this. And then after the 6th treatment, I noticed that all of a sudden, when I did eat, I wasn't as nauseated. The nausea was still there, but it wasn't as intense. And with each treatment, it kept getting a little bit better, a little bit better. I could eat a little bit more. And then by I think it was the 17th treatment, because I had a total of 20 treatments. The 17th treatment, after that treatment, I kind of, by the end of that week, I noticed, I'm not nauseated anymore. I was eating, and I wasn't getting that sick feeling in my stomach. And I thought, oh, thank you.
And Jeff, where did you direct? And we talk over the years that we've been discussing using a laser to eliminate and reduce pain. Where did you decide then? And it's non-invasive. It's a tool that you can use, as Michelle is suggesting, a number of times. You try to figure out exactly how many treatments you'll get, how long they'll last. It's kind of a warm sense, but it's a cold laser. How did you decide exactly where to go on the body to begin to reduce and eliminate her pain?
Well, it wasn't pain, but we just went over the incision mark and over the abdomen.
The whole abdomen.
The whole we treated the whole abdomen. So any scar tissue that was built up, or anything that was creating the nerve impingement on the nerve plexus, the laser remediates and eliminates scar tissue. And she's, Michelle's not the first patient that I've had. When we first opened up, we had a young lady come from Maumee, Ohio, 23 years old, who had her gallbladder taken out. Just like a 1-inch scar underneath her right breastplate. And 6 or 7 months later, she couldn't eat. And her doctors were giving her drugs and medications and sending her to a pain psychologist, and nothing worked. And the only thing that worked
pain psychologist,
because she was 23, they thought she was hooked on the drugs, and so, but she couldn't eat. And so the only relief that she would get when she would put her back against the space heater, and this poor girl, her whole back was burned and scarred from the heat, and that was when we first opened. I don't know, 5.5 years ago. And she would drive in, and she drove in 3 days a week from Maumee, Ohio. Her mom brought her. And it was about 10 or 11 treatments. She started getting relief. And it was scar tissue impingement. And we've had people come in with hernia surgeries. I had a gentleman that came in, because pain's subjective, Warren. And what's a 10 for you might be a 6 for me, and vice versa. But when you have someone that has a scar tissue issue, and we've had patients come in with post-surgery scar tissue problems, and we see the MRI and we see the scar tissue, and then we give them the treatments, and then they get another MRI after, and the scar tissue's gone.
Wow.
Well, that makes it objective. So now there's physical proof that this works for scar tissue. And so we recommend, we have a lot of patients that come in and they're thinking about surgery, and my focus is, listen, you can always get cut. You can't get uncut. So once you get cut, the complications are going to come. And so 70% of our patients are back patients. Last year we saw 827 new patients at Pain Free Life Centers in Troy. 70% of those patients were back patients. 85% of that 70% have had at least one, if not multiple surgeries. They're still in pain, and most are worse. We treat scars every day. So when someone has a surgery, if you have something like a knee replaced or a hip replaced, come in and see us right after the surgery, so we can remediate the scar tissue, make sure it doesn't happen, and it heals the area quicker. Jared Allen, perfect example, had a fractured foot 3 weeks before the Super Bowl 2 years ago. Laser therapy healed the fracture. He was able to play.
And you got a pitcher who used to be with the Detroit Tigers too, who dealt with a knee problem. I don't know, 5-6 different kinds of operations there that you worked with.
Yeah, Dave was. We knew what his
Dave Roseman.
We knew what his end game was going to be. He was going to need a knee, but we bought him some time. And once cartilage is gone, we can't make it grow back, but we can reduce the inflammation so the synovial fluid can lubricate the joint.
All right, let's open up our phone lines too. You're listening to what Jeff has to say, Michelle, what her experience has been. If you're going through bursitis or heel spurs or rotator cuff injuries or neuropathy or knee pain or foot pain or lower back, give Jeff a buzz and let him know what you're experiencing and what he can do for you at toll-free 1-800-859-0957. 1-800-859-0957. Call up right now. Tell Jeff what you're experiencing in terms of a pain, or someone that you know, maybe in the family or at work, and we'll see what we can do for you before this hour is up with Warren and Jeff on News Talk 760 WJR. We're back after some words from our sponsors.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And whether it's aching or burning or stinging or stabbing or throbbing, pain gets on your nerves. And when chronic pain strikes suddenly and signals there's a warning that something is wrong, it's time to take action. And that's why Jeff Morton, the director of the Pain Free Life Centers, is in the studio. If pain persists, as you pointed out a little while ago, Jeff, it places a burden on people's everyday life. An unrelieved chronic pain can drain your energy, keep you off your feet. These signals go to the nervous system. They can trigger depression and anger and anxiety. And Michelle's in our studio today, a former nurse dealing with nausea, and you took care of her there. You probably can relate, Michelle, to those symptoms as well. The experience, the sleep loss, the inability to work. At least 100 million Americans suffer from chronic pain conditions. So we've got the patient in, we've got the director of the Pain Free Life Centers in the studio. And if you have a pain or you know somebody who, give us a ring and let's see how we can help you out this evening at 1-800-859-0957. In Fraser, Cindy, you've been hanging on for a while, listening to Jeff, listening to what lasers can do, reduce and eliminate pain no matter where in the body they are. What was your specific problem?
Hi, Jeff. I'm going on 3 years with the same pain. It's in my head. It goes up the back of my head and across the temple area in the front. I've had 2 MRIs, CAT scans. I've been to an ENT. I've been to neurologists. I've even went to the dentist, a chiropractor, and nothing shows any reason for this pain. And I try to explain it's not a headache. It's pain.
Yeah. So it's not a migraine then, is what you're saying.
No. And it feels like burning lava across the front of my forehead most of the time. Sneezing, coughing. Sneezing just about kills me. Bending over forward, laying down or rolling over in bed, all those things cause the pain.
Is there any pain like under your eyes, around your jawline at all or anything like that?
No.
Okay, because there's a trigeminal nerve that can create that burning feeling across the forehead, but it's based right by the ear, and it can be created from the occipital nerve in the back. You have 3 nerves that run up the back of the head. That's your occipital nerves, and sometimes it can create some stress on the trigeminal nerve. I would really want you to come in and let me take a look at you and see where the pain is exactly.
Cindy, what have you been doing to deal with that pain in the meantime?
I try not to sneeze. I find that if I put pressure with my fingers on the spot that it hurts, sometimes I can find a pressure point that kind of relieves it. It doesn't last for a long time. It comes and goes, but when it comes, it's severe.
How long does it last? How long do you experience that? Length of time?
When it comes on, it may last 30 seconds to a minute before I can relieve some of the pain.
What pressure point? What pressure point are you using to try to relieve the pain?
On my temple,
okay,
or sometimes right at the bridge of my nose.
Okay.
The back of my neck.
And you may have been listening to Michelle before, who had not necessarily a pain problem like you, but nausea, and you didn't know.
I heard that.
Right, exactly. So probably Cindy's best bet is to come in, because the consultation is going to be free, Cindy. The first treatment is going to be free. And did you get the number down to call for an appointment? Because they really fill up fast over there. Did you mark it down?
No, I didn't.
All right, mark this number down. You have a pencil and paper?
Yes, go ahead.
248-879.
879.
Right, 1100.
1100.
And Cindy, you're close to our Shelby office at 24 and Shaner, so
okay.
Yeah, and give them a call, and they'll book you over there, and I'll see you, or the wellness coordinator, Dr. Wagner, will see you over there, and we'll get you taken care of. I'm positive we can help you.
All right. Good luck,
Cindy.
Cindy.
Thank you so much.
You're welcome.
Thank you.
You're welcome. Let us know what happens. Paul, quickly, you're on News Talk 760 WJR. What did you want to talk to Jeff Morton about? What was your pain?
Well, I still have it.
Oh.
I had my right shoulder replaced because I tore the infraspinatus and supraspinatus off. And I have a pain now that I have a muscle that I don't know the name of it. It starts up in the neck and it goes down inside of my right shoulder blade, down my back, and that thing just tightens up like a knot.
How often during the course of a day are you experiencing that pain?
All day.
What kind of impact is that having on your life?
Well, I Yesterday I had to lift a couple of things, and I had just come back from a physical therapist that she can get it to relax for maybe a day or so, but I had to lift some things I was putting away and I shouldn't have. It's just...
Paul, what area do you live in?
I am in Wall Lake, Commerce area.
Okay, so Troy would be the closest location for you.
Right, I talked to Nicole there today.
Okay.
But I didn't make an appointment because you don't take any insurance at all.
Well, it's not that we don't. There's no billing codes.
That's what they said.
Yeah. So what the issue is $312 billion is spent every year on pain meds, and so the FDA and the pharmaceutical companies really got a lock on that. And my average patient spends $600-700 a month on medication. But the question I'll ask
$600 or $700 just
month
on drugs.
On drugs, yes. So Paul, the question I'll ask you. I mean, think about this: how much have you spent out of pocket? How much of your life have you lost, and what's your quality of life worth? So, even though it's not covered by insurance, it's less than your deductible probably is. And, we'll work with you on the payments. We try never to let money stand in the way, but it's about quality of life. And, for me, I'm very passionate about quality of life. And I don't share this story with a lot of people, but I lost my mom when she was 36. And there was nothing I was 12. There was nothing I could do for her. And I've really spent my life passionately, and this is passion, trying to help other people live a better quality of life. And so you come on in and make your appointment, come on in and see us, and we'll work something out with you.
All right. And remember, the consultation is going to be free, right, Paul? And the first treatment is going to be free.
Yeah, so the girls are there, Paul, right now, and just call up and make your appointment because we'll get you in before the holiday, and we'll get you started. And let me take a look at what's going on. You probably have scar tissue impingement. You could have some muscle damage. It takes soft tissue over 2 years to heal. The laser will increase the blood flow and reduce the inflammation in the tissue, and we'll be able to help your pain.
Well, my infraspinatus and supraspinatus are not connected anymore because I have the reverse replacement shoulder.
Okay.
Placed on the right side, but just pain in the back. Well, I've always had back problems too, but I have spinal stenosis. I'm 80 years old. So.
Yeah. All right, well, do you have the number still, Paul?
Oh, yes, I do.
All right, 248-879-1100, all right?
Right.
All right, good luck.
Thank you.
Go see Jeff as we continue to talk with Jeff in our final segment. If you have, again, a pain you're personally experiencing, someone in your family, maybe possibly a child, because you deal, and at this time of the year, we got to take a break now, Jeff. When we come back, we should mention this too. This time of the year, got all these sporting events going on. You're dealing with kids at school, middle school, high school, that you're helping reduce and eliminate pain that they've gotten involved with.
I had a girl come in yesterday who fell out of a bunk bed, a senior in high school, and she has a huge contusion on her forearm. But guess what's Friday? Friday's prom. And so within 2 treatments, the contusion is 50% gone, and by Friday it'll be totally gone.
My goodness.
Yeah, we get it all.
All right, try to give us a buzz here before we sign off at 1-800-859-0957. We're back with our final segment after some important messages.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And if you're one of the over 100 million Americans suffering from chronic pain, you don't need me to tell you that when pain persists, even daily activities, driving a car, sitting at your desk, going to the supermarket, can be very daunting. laser treatments begin to reduce and even eliminate the pain in a non-invasive way. And Jeff Morton, very quickly here, the laser, as you were pointing out earlier, for those who are just tuning in, produces these photons of light. It penetrates the damaged cells, and when that happens, the pain relief begins, the inflammation goes down, and the tissue begins to
heal itself. Yeah, it does. It begins to heal itself naturally without any side effects. And that's the amazing thing about this, Warren, is patients. The biggest question I get is, how can one modality treat so many different things?
Exactly.
70% of our patients are back patients. We treat a ton of fibromyalgia. We treat lots and lots and lots of neuropathy, whether it's diabetic-induced or chemotherapy-induced neuropathy, and then a lot of minor things, arthritic pain, bursitis pain. We've saved people from getting surgeries and having them avoid surgeries.
Getting hooked on drugs.
Getting them off the drugs.
Even over-the-counter can destroy your stomach.
Well, we had, last February, we had a patient, 58-year-old male, had to have complete bowel reconstruction from Excedrin. So, it's terrible. And so our message really is to get people to use Pain-Free Life Centers as their first choice and leave the rest out. And that's it. If it doesn't work, you're only out a little bit of money and some time. And that's what we say.
And let's not forget about the veterans. You've been very passionate about them as well.
Yeah, so the veterans, to the heroes, the true heroes out there that give us the ability to have this radio show and live our lives the way we do.
Sure.
There's a big opioid problem in the VA and with the veterans. And so what we're working on right now with the Department of Defense and the veterans, and we've already been appointed by a company that is a service-disabled, veteran-owned small business to be their official pain care and wound management, Spartan Medical out of Maryland, not out of East Lansing, but go green. And so and so we are working with that right now at the John Dingle building with a couple of doctors down in the VA hospital there to be able to get the veterans this treatment and have it no out-of-pocket costs for them. The second phase we're going to do as we roll this out on a national level is we want to take veterans and train them to become laser technicians, give them a job when they come back from fighting for our freedom, and help them have a career. And my attitude is, who better to treat a veteran than a veteran? I wasn't over there. I didn't fight in a war. I don't have any idea what the veterans have gone through, so I can't help them from an emotional level. But a veteran can, and that is our mission at Pain-Free Life Centers.
And that's the same number to call, 248-879-1100, which, Michelle Ferris, you did to handle your nausea. But wait, before we run out of time, you had another pain pop up where, on your foot somewhere?
On my foot. I have a neuroma on my right foot, and I had them start treating that.
You had not an aroma, you had a what?
It's called a neuroma.
A neuroma,
right?
Not something that you smell.
Right. And I had them start treating that. I think I'm like 10 treatments in. And, already it's not. I can still feel it a little bit, but it's nothing like it was before. I could get out of bed in the morning and step on it. It's like stepping on a pea on the bottom of your foot.
What is an aroma similar to, Jeff?
Well, it's a cyst at the end of the nerve endings, and women get it usually between their second and third toe.
Yeah.
From wearing high heels, and usually I don't see very many men with neuromas. So every once in a while I get one in, but so it's kind of like a cyst-like material, and it's in between the toes, and it's always in the same spot. And the laser will remediate the cyst and make the neuroma go away, just like it does with scar tissue and bone spurs.
Right, and spending the decades as a nurse here, a licensed practical nurse, Michelle Ferris, when you began there, you probably weren't even aware, or how long did it take you to become knowledgeable, beside hearing it on WJR, about what lasers could do to eliminate and reduce pain?
Other than listening to them, you guys on the radio for years. I had no idea, but now that I do, I honestly would recommend anybody that had surgery to go in and have a treatment afterwards. It's going to promote healing and reduce the scar tissue, and then maybe they wouldn't have pain if they didn't have scar tissue. People don't understand how bad scar tissue can really cause pain. So
and,
I think
and you recommended it to
my boss.
What did he have? Shoulder pain?
He had some shoulder pain. Yep.
Yeah.
And it took him 6 treatments before he thought it wasn't going to work. And I said, "Oh, it will." And so now he's on like his 10th treatment, and he's a lot better too.
Don't do the drugs over the counter or prescription or get addicted to those or the surgery. And what do you say over there at Pain Free Life Centers?
You've got nothing to lose but the pain.
Yeah, no doubt about that. Call, make an appointment at 248-879-1100. Thanks to Mike and Narina. Stay tuned. The news is next.
The preceding program has been presented by Pain Free Life Centers of Michigan.